Lisa. How are you today?
Good, how are you?
Oh, good, good. So my name is Tina Sherman. I'm a registered nurse. I've been a nurse in this field, oh my goodness, since 1994.
Mm-hmm.
So one of the things that we're going to talk about today is Sculptra.
Mm-hmm.
And after seeing you, I think this would be a great opportunity for you. Let me tell you a little bit more about Sculptra. Sculptra is polylactic acid, and it's the same component that they use in dissolvable stitches.
Oh, okay.
So with that being said, it's been worldwide used since 1999, and it started with HIV patients.
Mm-hmm.
And what they found with Sculptra is that over time, when people would lose volume, loss of elasticity, and they would put this polylactic acid into the face, it would revolumize gradually over time, and it would provide a very youthful appearance gradually. So if somebody doesn't want to entertain surgery at this point, they're keeping their wrinkles at bay, and they want to stimulate their own collagen, this is a wonderful process to do. Okay, so let's take a look. What are your concerns, first of all, that stands out when you look in the mirror? What do you see?
Just the beginning stages of starting to age. So I know like the nasolabial folds are a big sign of the starting of the aging process. So I don't want to get any older. I want to kind of freeze time and maybe reverse it a little bit and then just have some help.
Okay, so having a plastic surgery background, I like to really connect up the dots.
Okay.
And you're a beautiful lady. So I think that what I see as far as aging is as we get older, we start to see right here a little bit of malar separation. See that little difference? As we age, the skin starts to flatten down. This is what creates the fold right here. And you have a little bit of a separation right here.
Like looking tired or dark circles, that type of look. Okay.
Exactly. We've got a little bit of this little line around the corner. We have a little bit of a marionette. And this is, over time, this will eventually get deeper. The beauty of Sculptra is that we are stimulating your own collagen naturally. And this is a gradual process, like I had said before. And what's great is by the time that when you hit 4 months, 5 months, you're going to look better. 6 months, you're going to continue to look better. People won't know that you're doing anything because we're not doing fillers. We're doing just a collagen stimulator. So again, I would address here and here. And again, as we get older, we get a little bit of a separation in here and here. I like to start with collagen, with the Sculptra, to stimulate the collagen in the back. I call it framing the house. And this way, when we thicken up this little area, thickens up the skin, makes a nice pull. Thickens up here, gives a nice jawline definition. And again, I would put in here, here, and here, and here.
Okay,
So
great.
with that being said, okay. All right, let's get started. One of the things that I do is I like to give patients a little lidocaine with 1%. The reason being is that the Sculptra, although it's quite thin, it's made up of these little beads. And we have to use a 25 gauge 1-inch needle. With that being said, it's not very comfortable doing this with just like a topical. I find that the patients will relax more if they have a little lidocaine injection. Also, if they also have a little bit of vasoconstriction of the blood vessels, they'll have less bruising, they'll have less swelling. And this to me is really beneficial to my patients. They really enjoy this process. It's nice and easy, and as you can see when I start to inject, this will be a great thing for them. I want my patients to really feel comfortable and feel at ease, not feel like they're going to have any issues with bleeding or any discomfort. If they do have a little discomfort afterwards, it's usually a little bit of swelling, tenderness, a little bit of redness. There could be some possible bruising. Post-operatively, I like to use ice. I like the patients to start on some arnica about a week to 2 weeks before. Depends on if they're on blood thinners, then 2 weeks before. But if they're not, a week before of arnica would be great. And to continue with that arnica post-operatively, as well as icing for a couple of days. But other than that, Sculptra is a fantastic volumizer, and I think that Lisa will be very, very happy with this. All right.
Okay.
To show you exactly where I'm going to go ahead and put this in. Okay, if you could please be kind enough, put your head back. Okay, so Again, we're talked about these little areas here. Okay, we're going to do a dollop here, a little dollop there. Okay, I'm going to put a tiny bit right in here. Coming up here. Coming up here. Okay. It's going to make you look natural.
Okay.
That's why I love Sculptra, because it's known as the best kept secret in Beverly Hills. So as you can see, you got some nice blanching, and that means that she's completely numb. And again, this will prevent bruising, and just a really great way to go. It's a good opportunity to come in on your lunch break and put a little Sculptra in and then go back to work. After a couple weeks, patients report to me, and I've seen it too, in about 4 weeks' time, you're going to start to see this beautiful volumization of collagen, and you're going to start to see changes. It's very exciting. Patients love it. They are so excited, they want more. Typically, we can address those issues at that time. We can say, you know what, I think I'm very detail-oriented, so I will cater individually to each person, what their needs are, where their loss of collagen is occurring. But you're going to start seeing things around 4 weeks.
Okay,
It's
great.
amazing.
Yeah.
It's amazing. So what I'm doing right now is, this is so part of your aftercare instructions is you want to massage the rule of fives. 5 minutes, 5 times a day, for 5 days.
Okay.
And after that, there's no need to do it. Super easy, and you can use your hands. You can use your cream. You can use a Clarisonic when you
great.
clean your face in the morning. As long as you're massaging and it doesn't have to be firm. It just nice and smooth, just smoothing it out. Nice and smooth.
Like sculpting, like
Yours-
Sculptra.
Exactly. Exactly. And it's everybody's different. When people come to see me, there's usually people that have different concerns, and like I said, I like to address the whole face that I've seen open on the in surgery. So I understand where there's collagen and fat loss over time, and I just like to connect up those dots and bring them back where it looks again natural. And as you can see, Lisa doesn't really look, even with 2 vials, I put in total of 14 cc's of fluid. And as you can see, she looks fabulous. Beautiful, natural. The fluid is going to go away. She's going to look the same. And then every week she's going to continue to remodel that collagen in her skin.
And maybe just for this weekend, it'll look a little more plumped up,
It's
or a
gonna
little
look-
more youthful, and then it'll kind of.
It will come down, exactly. Doctors here are extremely experienced and can address those surgical needs as well. So we've got it all covered. This CosmetiCare is your one stop. And we're here to give it all to you. You don't have to go anywhere else. We can address all your needs here. And that's what we're here, is we are here to be a family and to get our patients to continue to see us and to know that our girls are here for the long run. That's what we are here for. So we hope to keep you young, not grow old together, but to grow young together.
Good.
Yeah.
Thank you.
You're welcome. My pleasure.